Assalamu alaikum. Welcome to another episode of our health show. Today we have with us again Professor Karim, who we have specially invited to talk on something that is very poorly understood in our community about autism. First of all, welcome to our show, Doctor.
Thank you very much, Fatema. It's always a pleasure to be here.
Starting with the first question. Professor, what is autism?
Before I answer that first question, let me first emphasize on what you just said. Autism is a condition which is poorly understood, rather stigmatized, and totally neglected. And therefore, I really appreciate for you choosing this topic for today's health talk. Autism, the word autism comes from the auto. Auto means autonomous, independent, leave me alone kind of definition. It is a complex neurodevelopmental disorder, a disorder which affects neurological and developmental condition of mainly children, but can go into adult life. It is a very intriguing condition because it is very ill understood by many people globally, and that is why we have on 2nd April of every year something called Autism Awareness Day, just to let people be aware of autism. And this is something which is upcoming, maybe because of increased information or maybe because increased diagnosis, but I think from the research I have done and seen, I think it is a condition on the rise rather than increased diagnosis.
So you said it is a neurodevelopmental disorder.
That's
Are
right.
there any other disorders of the similar type?
Yes, so this is a particular neurodevelopmental disorder in which the fundamental problem is social interaction, social restriction, or social impairment. Number one most important problem in this neurodevelopment disorder is social impairment, communication difficulties, restrictive ideas, repetitive movements, stereotype behavior, and the child is in his own world. Unlike other neurodevelopment disorders, autism has got this cocoon, this shell in the child, but because it overlaps with many other neurodevelopmental disorders, we have disorders like Asperger's syndrome, or we have a disorder I will explain to you about Asperger's syndrome, and I am sure audience will appreciate when I talk about Asperger's syndrome. But we also have a condition similar to autism called Rett syndrome, Rett, R-E-T-T.
So it's a broad spectrum.
Yeah, it's Rett syndrome, Asperger's syndrome, and then there are other disorders which are not really fitting to autism, and they are called pervasive because they pervade, they are all over. Pervasive developmental disorders which are not otherwise specified. So if you have autism, Asperger's syndrome, Rett syndrome, and then you have others such as developmental disintegrative disorders like cerebral palsy, mental retardation due to other causes, Down syndrome and other conditions which also cause mental retardation. These are childhood disruptive or disintegrative syndromes,
which are very different from autism.
So developmental disorders are a spectrum, a good number of them, in which there is autism, Asperger's syndrome, Rett syndrome, pervasive developmental disorder which is not otherwise specified, and then you have those neurodisruptive disorders such as mental retardation, cerebral palsy, Down syndrome and other conditions.
How prevalent is this?
It's important to realize first these conditions, and then I will talk to you about this important question, the prevalence. For example, Asperger's syndrome, traditionally it was known as the little professor syndrome.
The little professor syndrome.
The little professor syndrome. So it's kind of funny the way it has been described historically, like in the early 40s and 50s. Asperger's syndrome was described by the scientists as the little professor syndrome. So it's not this little professor, but it's little professor syndrome. So you have like young little boy who is an introvert, kind of, he doesn't want to communicate with anybody. He's very brilliant. So that distinguishes Asperger's syndrome from autism, because he's not mentally retarded. His cognitive development is good. He's very smart. He's very sharp. He understands everything. He is just socially unable to interact. So you find this guy who is very clever, very intelligent, sits here with you, doesn't talk, doesn't communicate. You two adults are talking something, and he would just give such a comment that it would leave you two professors or two intellectuals just dumbfounded, because he talks such sense that he behaves like a little professor, but he doesn't communicate with anybody. He is totally lost social inhibitions or social interactions. So I would also compare that with, if you see the cartoons, you know, in the cartoons, you have some very important element happening in the caricature. And then there is little small Panya who is just running away in the corner and giving a very cynical comment, which is very relevant. So Asperger's syndrome can be well understood if you have seen one movie, My Name is Khan and I am not a terrorist. You see how he behaves. He doesn't interact, very restrictive. Then all of a sudden he blurts out something which is very, very relevant and important. He's caught in the middle of a crowd and he says, my name is Khan and I am not a terrorist.
Something
Period.
That's very relevant.
Very relevant, a professorial message, but his Asperger's syndrome. It's completely socially impaired, with a stereotype behavior, with a fixed idea. He walks just without looking at anybody. He doesn't talk to anybody, doesn't communicate, or with opposite gender is so restrictive, can't express himself. That's Asperger's syndrome. In Rett syndrome, it is something very similar to autism, but in it mainly occurs in girls, and they have like repetitive hand movements. They have repetitive hand movements, finger movements. Repetitive finger movements, no purpose. It's just continuously tick kind of movements. It happens in girls. So, coming back to your question.
Wait, before you go there, in this Rett syndrome, is there any sort of social interaction?
There is no social interaction. It's very similar to...
In all these three syndromes, there is no social interaction.
That social interaction and social impairment is profound.
Okay.
So, coming to prevalence, if you allow me, maybe I would just say a little about prevalence globally and then prevalence in Africa. Globally, in the early 40s, it was considered like 1 in 10,000 in early 40s, and considered to be schizophrenia, kind of mental disease, some kind of psychiatric illness. And then in early 60s, they thought it was 1 in 1,300. Of late, incidences from various states in the United States of America range from 1 out of 33 children to 1 out of 100. And if you go to a center which deals with neurodevelopmental disorders, this is in the population. 1 out of 100 in a general population, right? So in a general population, like we have 100 children in the community, 1 of them would be autistic. So those kind of prevalences are seen in United States, UK, and other developed countries.
Which is not low.
Which is very high. If you have 100 children in a school, for example, in Union Nursery School, you have, I think, 1,000 children. If you have 1,000 children in a nursery school, for example, then you expect 10 of them to have autism. It's serious. So in US, some of the places are 1 out of 33 children. So out of 100 children, 3 of them have autistic spectrum disorder. It's quite high. So these are the incidents in the US. In Tunisia, in Egypt, in North Africa, incidences have been found like 1 out of 150, 1 out of 200 children. In India, in some areas, up to 1 out of 100. So I don't think we are an exception, not only as a community, but even in Tanzania in general as a whole. I think the incidence is quite high. I can share with you if you would wish to, and because the audience may not only be our community, for the sake of any other audience about autism in Tanzania. The brief little research which I have done in Tanzania on prevalence of autism, from statistics obtained from Ministry of Education in the Special Needs Department, I was told there are about 24 schools which deal with autism in Tanzania. And each of the schools has about 8 to 15 children. In some schools there are more than that. In some schools there are much lesser than that. So on average you would expect about almost 200 children who are diagnosed and going into these schools. But there are tons and tons of these children who are undiagnosed and don't go to the schools.
So the data is not relevant. There might be more.
So there is no smoke without fire. If you have in the schools 24 special needs schools, and you have already 200 children in Tanzanian schools, Tanzanian children, then means there must be something much more out there. So to put this into more emphasis, I did a small survey, and this hasn't been published yet. In children who were attending mentally retarded, cerebral palsy special school, not autistic school. In this, we actually found there are many, out of the 40 or so we reviewed, I found that there were already 8 of them who were mislabeled to have mental retardation and cerebral palsy actually had autism from the criteria which we use to screen. So there are a lot of misdiagnoses out there. Likewise, in our community, I suspect there might be many children with learning disability and social impairments and things which may be mislabeled as Mkorofi, Mastikor, Wairo, it's just not, he just doesn't want to study, he just doesn't mingle with anybody, doesn't greet anybody, introvert, leave him alone. So it is important to raise this awareness in the community.
Definitely. Now, since you have talked about what autism is, its prevalence, what are the symptoms of autism?
It's very important in order to recognize the symptoms. So, as a parent, how would I recognize that this child might have autism?
Because it's quite difficult, because it's diagnosed in children.
Yes.
So it's difficult to try to monitor that is my child okay, or
is having not? Some autistic
so
features.
How would the parent know?
So sometimes you find autism is very wrongly or in a combination with other conditions considered, oh, my child might have autism. There are different signs and symptoms which you can detect in children. For example, children who are labeled as attention deficit hyperactive disorder, ADHD, or dyslexic, or other kind of functions, they might be having symptoms of autism. So as you said, let's come to the point. So how do you recognize your child? God forbid this condition, because it is something which is a big liability to the family, something which requires a lot of support and care, which we will come to it later if time permits. Normally these children grow well at birth. So the development milestones, 6 months able to sit, 9 months crawling, 12 months standing with support, and then 15 months already running around, walking, talking mama, dada, papa, ile, uyu, baya, toto, all those kind of babbling words, very interesting, very happy children's beautiful words. 1 year, 1.5 years. Then at 2 years you find something is quite wrong. He stopped talking, he is not mixing words, he is confined to just one statement, he is becoming aloof, he doesn't want to greet anybody, doesn't like change of routines, and he starts not communicating with you.
So mainly the child develops normally, and then the development
Then you find
regresses.
it around 15, 18 months, 20 months, 24 months, regresses, just shuts himself down, just doesn't want to communicate. He won't respond, he won't have eye contact with you, he won't greet anybody. So that is that age where at 2 years you as a parent want to say, oh Karim, listen, uncle has come, say salam to him. And he's
he doesn't want to interact.
Doesn't want. Or your other cousins and other siblings are here, play with them, and then he engages in repetitive play. So if you give him a car, a motor car, normally if you give a normal child a car, he would zoom it around and play with it and gonga accident it on the wall and find it funny because it bangs on another toy, and this is how he plays the car, or does a racing or goes around with it all around and plays with it as a car. You will find your child is not interested in it as a car. He takes the car, looks at it, and then looks at the wheel, and then touches the wheel and just goes on rotating the wheel and go on hours and hours and hours and hours and hours and hours and hours just playing with the wheel.
They like the rolling movement.
They like repetitive, circular, behavioral, stereotype movement. If you give him a phone, then he will want to go just to one thing all the time and just listen to that same thing. So if he has by default learned something on your phone, he will go to that same thing. He will keep on pressing tone, 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 which will keep on clicking, whatever the sound of that tone. It goes on and on and on. You will get irritated about it, but he'll just want it to go on again and again and again. So you find the repetitive movements, social behavior is going down, communication with you is going down, eye contact is going down, routine stereotype activity is required. This is the time you should be concerned. That is my child having autistic disorder? The earlier you know, the better, because there are behavioral therapies
That might improve.
which improves, which helps a lot in recognition and family interaction.
So at what age does the symptoms mainly appear?
So the earliest symptoms can appear around 18 months.
18 months.
So it is good to have a toddler 18 to 36 months have a screening done as part of the neurodevelopment assessment when you go to the clinic. If you find if there is any neurodevelopmental disorder in the family of any nature, it's good idea to say, why don't I take my child also, who is now 24 months, to just go and have a routine, a screening done by a pediatrician or a psychologist and see whether my child fits into any of these things. I'm just concerned. It's good to be concerned about it. It's not being paranoid and panicky about it. Don't rush now and start rushing to the clinics to get autism screened. But it's good idea to keep in mind, if you suspect anything, it's good to talk. It's good to find.
Early detection would help the
Absolutely, you said it.
Now, does autism affect the brain, or it's the brain that causes autism? Like, does it have an organic base?
Yes, there are reviews, and I would like to quote some article here about the things about the brain. So, is there something in the brain which is actually organically or structurally abnormal in the brain? So, to make it simpler for our audience, the brain is a very complex organ, and just like any computer or any sophisticated machine which has got little different parts, the capacitor, the diode, or whatever connections, the wires and switches and things. Likewise, the brain has got a lot of things, and being in the medical profession, all the different parts of the brain. So it has been found that children with autism have an increased head size and increase in brain size. Why? It isn't very well known, but it has been found 20% of children with autism had a bigger head size compared to normal. So there is something going on in the brain. There is a segment in the brain which is called the amygdala, which is part of a brain which processes a lot of psychological, social, and also the frontal lobe of the cerebellum. So there are certain parts of brain, including cerebellum, where there are something called the Purkinje fibers in the cerebellum, and therefore it has been found that in the cingulate gyrus of the cortex, in the Purkinje fibers of the cerebellum, in the amygdala of the caudate nucleus, those have been found to have some abnormalities. So increased head size, increased brain volume, some of the hippocampus areas of the brain have been found to have some abnormalities.
So it suggests it might be having an organic
basis. And a lot of research is being done in the world about various brain lesions which might be associated with autism. There are other things in the brain. As you know, there are chemical substances which are called neurotransmitters. For example, when you are excited, adrenaline is produced. Everybody knows about adrenaline, the adrenal rush, something to make you stimulate, and then you sweat and your muscles become powerful and you have intensity of running and shouting and screaming and fighting or fear or something. Adrenaline comes out from the body.
The fight and flight hormone.
Fight and flight hormone, the adrenaline. Likewise, in the brain there are neurotransmitters. These are GABA aminobutyric acid, for example, glutamate, the serotonin, the dopamine, the norepinephrine, and other neuropeptides.
That help carry information from the brain to the concerned muscle.
Exactly. Interact with different nerve tissues, with different connections and things. So it was found that mothers who took serotonin inhibitors, which are in the form of antiemetics, those who took dawa for these medicines for preventing vomiting during pregnancy, or psychiatric disorders, they feel very depressed during pregnancy, this and that, and then they took some medications. These are serotonin inhibitors. They might affect in the neurodevelopment of the growing brain. These are all many things which have been discovered. The neurotransmitters, the structural deficiencies in brain, also genetics. Some genetic studies have been done to see that it might be genetically related.
Meaning anyone in the family, if there is a child with
So,
autism,
yes.
it's more likely that.
So they
one's
found
child
that it was twice more likely in a family who already had one child, or in twin studies they found that twins, both of the twins were affected. And if one twin was not affected, then it was not a same placenta sharing twin. It was a different twin, a different gender. It was a female twin which was saved from the male twin. So twin studies found increased incidences in same families, incidences. So there might be some genetic.
When you talked of vomiting, it might raise concerns in our viewers, because vomiting is a very common symptom during pregnancy.
Definitely.
And since you say that some of the medications that you use during pregnancy to prevent vomiting can cause autism in your child. So it's quite controversial.
Not exactly that way, but these drugs, when they are taken for a longer time, they inhibit serotonin. If you inhibit serotonin, then there is a deficiency in the brain growth in the growing child. So you have to strike a balance. Is this vomiting bearable and tolerable, and therefore I can just ignore all these medications? You find in medication leaflets they have written it has been tested in pregnant animal species and no effect has been found. But we don't know the neurodevelopment in those animal species. They have tested it to see if there is any abnormalities of the heart and limbs and abnormalities, congenital malformations and eyes and ears and those problems. But what about neurotransmitters? We don't know. And therefore they will caution, use with caution in pregnancy. It has not been tested in animal and human studies. So you have to be careful about it. Definitely.
Just if the benefit outweighs the risk.
Yes.
How is autism caused?
So
in a summary.
In summary, as we said, there might be genetic, there might be brain problems,
What
there
about
might be
environmental factors?
there might be neurotransmitter problems. Environmental factors, very, very important. There are a number of theories raised on environmental factors, such as some kind of chemical toxins in the environment, some kinds of food in the environment, some kind of feeding practices in the environment, and vaccinations is a big controversy about vaccines. Out there is a lot of literature talking about vaccines. I don't know for sure, and I can't say because I haven't done research, but there have been some papers which have been withdrawn from the circulation about possibly some vaccines causing some problems. You know the controversy about the Wakefield study. Wakefield was a scientist who published a paper in Lancet some years ago, about I think 25-30 years ago, from UK, and his paper said that MMR vaccine was associated with several mental disorders. And then it was found to be a very poorly conducted study which had no consent given properly, and some of the research council, medical research council of the United Kingdom refuted that they have never given any consent or permission, and this was a poorly designed and conducted study, and the results were haphazard, hodgepodge, and they withdrew the paper from circulation. But then several years later, after this paper was removed and the damage caused about the harm of MMR vaccine, people refused to take the vaccine. And then after a lot of campaign to reinstate again the vaccine, after some years in the early 90s, it was found that mercury toxicity caused brain problems and neurodevelopment disorder. And there is a chemical called thiomersal.
The heavy metals.
The heavy metals which contains mercury. Thiomersal is one of the components of vaccines preservation. So when the controversy started about thiomersal in the vaccines, the CDC, the Centers for Disease Control Atlanta, and the WHO recommended that all the vaccines should now not contain thiomersal, although they refuted and they proved that it was not causing any neurodevelopmental problems, the thiomersal did not cause in those which are existing, but Bora, Hafazali, let's remove it. Now, that is the question to ask myself. If you don't find it to have been caused, but it may be, let's remove it. We have tons and tons of vaccines in Africa which have been donated and they contain thiomersal. Now, if autism, this is my question, if autism is because there is improved diagnosis now, and autism, when it happens, it doesn't disappear. That means if autism has been improved diagnosis, then we should find adults who have autism, because at childhood they had autism. So is it improved diagnosis or actually an epidemic? That's a question to think. If it is an epidemic, why did it not happen to us or our siblings, and it is happening to our children? Is it because we are exposing them to all those environmental toxins which we are giving? All these artificial flavors and colors and things which we are seeing, which we have not had in our childhood, are they affecting our children?
Because according to the data, the prevalence is actually increasing.
Absolutely. So, we have to be careful of what we feed our children and what we vaccinate our children and what we give our children. Just because somebody said and there is a panic attack somewhere, so everybody rushes for the vaccine. Why? Think, is it a life-threatening condition? Is it going to kill your child? Then give the vaccine. If it is not a life-threatening condition, why are you so much obsessed about vaccinations? So this is my view. This is my personal view, and it is not my university's view. But these are based from observational studies, from other articles, and from what is going on. And therefore we need to be cautious about the type of food we eat. When I talk to you about GABA, gamma aminobutyric acid, the neurotransmitter, GABA is abundantly available in breast milk. Abundantly available in breast milk. And therefore it is something neuroprotective to our children. We find a lot of teen milk written, oh, we now have this chemical inside which is neuroprotective. Are you sure? Are we not overexciting our brains for our children? Things like Red Bull and all the neurotransmitters and stimulants, these are harmful to the bodies, and they affect our genetics. They affect our sperms and ovums, and therefore our children will be affected with it. Think about it. You are consuming it, and then what happens to your generation? That is why Allah said in the Quran, وَكُلُوا مِنْهَا رِزْقٌ حَلَالًا وَطَيِّبًا. The meaning of طَيِّبًا means pure, pure in its natural organic form, not adulterated with all chemicals and preservatives and colors and flavors and things. Eat one which is halal and pure. It is halal to eat a lollipop, but there is blue color in it. You find blue colored lollipops, unusual kind of things which cause many other things. Are these chemicals cumulatively affecting our children's brains? Are these things which we are injudiciously giving in the cause of being very loving affecting our brains? Are these exposures which we are seeing maybe affecting? So environment is an important element. So there are studies which have found on these environmental allergies, food allergies, the parental relationships, diets, different types of diets, drugs which we are consuming, and these kind of things are there. And I don't want to deny them that they don't exist just because they haven't been categorically proven or disproven. but they do affect the brain of the child. So sorry to be very compassionate and passionate about it.
Coming to our next question, you talked about 3 distinctive symptoms of autism. The first one was social impairment, meaning they don't want to interact with others. The second, you talked about the restricted movements, meaning they want everything in a routine.
Very high.
And the third thing was the communication impairment. Yeah. Now, with these 3 conditions, the management has to be a teamwork.
Definitely.
Right? The doctor and the parents. So how are the parents supposed to be trained to help their children?
This is the most important aspect of, first you recognize the child as autism. Then what is the next step? Once you recognize earlier, then you look, there is an argument. Before I come to that answer, there is an argument. For example, me, I don't want to speak to you. I just decide I don't want to speak to you. It's my will. I just don't want to speak to you. So just me. So why don't you respect me? I don't want to speak to anybody. I'm fixed routine. Don't look anywhere. I'm just doing my work. So think about that perspective. What does this child with autism, does he deserve that respect, to be left alone and understood the way he is? You have to first understand that very important human aspect. Listen, we have social norms, what we call the paradigms, the social norms. This has to happen this way. The child has to be born, at 3 years goes to Union Nursery School, and then the Malim will come home to teach Quran. At 6 years he'll go to Standard 1, fixed mentality. And then once you finish O levels, A levels, if you have born and brought up in India, then you have to have a child who goes to become an engineer or a doctor. If you are in a particular community, then it has to be a businessman or this kind of thing, or stereotype. We have a fixed paradigm. We don't go out of the shift of our paradigm.
Meaning no change. What's been happening will
So we
continue to
have
happen.
the whole. So the thing is, we are reluctant to change. So in a way, we can call ourselves a kind of autistic spectrum disorder, because we have a fixed routine. We don't want to change. If we find our son wanting to become a plumber, fundi bomba, then you will convulse. We have a fixed routine, not to understand what he likes and what he wants to do, because you want to have that fixed routine, a paradigm. We don't want to accept a paradigm shift. So when you have an autistic child, you are frustrated because you are a parent who kem salam nathi karto, kem aam nathi karto, khabar nahi su karu aa bachane. That's wrong. You have to understand him. I'm saying him because it is 4 to 5 times more common in boys, autism.
Is there any reason why it's more common in boys?
Maybe genetic, maybe brain development. Okay? So you have to understand him, that it is him and his perspective and his life and him. So be like him. You shift your paradigm and behave like him. And you will click.
Meaning they are different.
They are different.
Not sick, but they are different.
They are not sick.
So we have to adapt to understand.
Once
them.
you understand that thing as a teacher, as a doctor, as a parent, as a sibling, then you will understand your loving autistic child, brother, student, and colleague. Because you have to understand them. You don't have to make them understand routine, your paradigm. You have to shift the paradigm. You have to be them. Then you will see the difference. So the parent have to be counseled. It is a behavioral therapy, it's a family therapy. It's important you understand your child. Your child is not a disease. Don't stigmatize him.
He's just different.
He's not, he's different. He's him. And now you have to understand him. You have to change to him. Why should he change to you? Why should he start talking to you and salam to you and salam to him and to her and uncle and auntie and grandparents? Why? You behave like him. Why don't you shift the paradigm? It's a very important statement to understand.
That's the first thing in its management.
So, there are various aspects of that behavioral therapy and management. There is the behavioral therapies. There are various names of these behavioral therapies. And whoever occupational therapist is out there will tell you about more details about this behavioral therapy. For example, there is something called the pivotal response training, something very important. Or there is something called the sensory integration therapy, or something called the relationship development intervention. There are other many therapies which have been described, and I will give you an example. We commonly say autism should go for speech therapy. They don't have a speech problem. They have a communication problem.
Meaning they know, but they don't want to do it.
Yes, right? They can speak. They have good larynx. They have vocal cord. They understand the language. They can say, they can sing, they can speak if they want to. But there is a communication problem. So let me give you this communication problem thing, and then also give you an example about an autistic child who has a fixed routine of having one item in breakfast, and then how you can break that thing. So in one of these therapies, the sensory and the response therapy, how it integrates there. So let's say it by an example. The autistic child has got a communication problem, and he can speak anything he wants at any other time. For example, he can swear, matusi, garu, he can swear. He knows how to swear. He doesn't because he doesn't speak. But there might be a time that he is irritated and he may just swear in public and embarrass you as a parent. So what do? You want to train him to some level, go and behave like him. But at the same time, you don't want him to say that in this particular time. So now here there is a response therapy interaction. So you go and hold him or take care of, catch him and put him in a corner and say, look, he wouldn't like that. This you cannot do. Likewise, so that is about kind of training to socially behave at an extreme level.
But autistic children have a tendency to be rebellious, to overreact to situations. So wouldn't that therapy worsen the situation?
It helps. It helps. Again, here they are actually not rebellious or aggressive. They are rebellious and aggressive because you haven't understood them. You want them to go with you to the flight, but they cannot go to the flight because you will expose them to many people in the plane and they will have to greet them, and they don't want. And therefore they appear to be just holding on the rail of the staircase of the plane, and they don't want to go. They don't want to go. So now if you understand that part, this is how you would be able to train. So let's give you an example of the breakfast thing. So here is Karim. He never says I. I doesn't belong to autistic children. He would say to the mother, Karim wants kitumbua. He's sitting on the breakfast table and he wants kitumbua with chai. And you don't bring kitumbua, you keep mandazi. He says, Karim wants kitumbua. He won't look anywhere, no greeting, nothing. And you say, there is no kitumbua today, you eat mandazi. He won't eat. He will throw a tantrum. so much till the kitumbua comes, or if it doesn't come, then he will be exhausted if he just not eat it. So one of the best way to the parent understands that kitumbua must be. So the parent comes today, like we are sitting here, you are the parent, I am the child, you are bringing kitumbua and mandazi on your plate, and you are putting my kitumbua in my plate. And you say, okay Karim, have your breakfast. So while I am having my kitumbua, you are having your mandazi, and you are having it with style. You are having it with drama. So you are like eating that mandazi and say, it's so nice. I would rather have this mandazi. It's so delicious. This mandazi is so nice. Now this Karim is able to hear, this Karim is able to understand. He just doesn't want to communicate, he's just not social. So he eats his kitumbua, but he listens for a split of a second. They have emotions, they understand, they know everything, they have pain, they have affection, they also love their parents. So mom, inside he is making a formula. For a split of a second he will glance at the mandazi, he keeps on eating his kitumbua. Next day you repeat the same thing. You are eating your mandazi with a drama, maybe with the father sitting opposite here and you talking about the mandazi, and at the third day you leave him with a mandazi and a kitumbua, you will find him actually picking the mandazi and eating.
Meaning indirectly you're trying to break the change.
You are breaking a change. You are bringing a change indirectly by you breaking the paradigm, understanding him. And he will eat that mandazi, and you internally will be thrilled that right now he is able to also eat mandazi. So when I keep him, any one of them, next time he won't make a fuss. You are breaking that routine. But you have to have that patience and understanding to do it.
That's only possible if first you understand.
You understand the
that
situation.
Child is different.
Likewise, you are in a class, and if a pencil drops, what is the first reaction with you when a pencil drops?
I'm going to pick it up.
He will pick it up. The autistic child will not pick his pencil. Even though he is writing, if it falls, it's fallen. The teacher comes and asks, why didn't you complete your work? Why didn't you complete your work? The pencil fell. He will say that. The pencil fell. So why didn't you pick it up? The pencil fell. It's pencil's fault. It fell down. It's not my fault. If it fell down, I'm not going to write. That's me. So the teacher who understands this autistic child will say, oh, I'm so sorry, you haven't been able to complete this because your pencil fell. I should have known this, man. So he feels good that, oh, he's not blamed about it. It's a pencil which fell. And you give him another pencil. He says, my pencil. He won't say mine, he say, the pencil fell. You will pick that pencil and give it to him, and he will start writing. So you have to understand that psychology. You see what I mean? So even the teacher has to understand the child, the parent has to understand, the environment has to understand. And this child can slowly, they improve. As they become adolescent,
right?
they don't cure, but they improve, they become sociable, they are educatable. There are autistic children who have become ophthalmologists, there are autistic children who have become accountants, there are autistic children who have become geniuses in their work. They just do their work, period. They may have social interaction problems, but they are doing their job. They are earning, they are living normally.
So mainly it's a therapy that helps them improve.
Yes.
Right? Are there degrees of autism?
Yes, they are a wide spectrum. So you have high function autism. An autistic child who is very high function means it's almost normal. And there are autistic children who are very severe, who require a lot of help. So this is a big spectrum.
I think you have some things about the management.
Yes, I have it here, and we can put this on display. This is a set of 3 DVDs. It has been given to me courtesy by one of a whole set was brought to me, specifically bought for me, because I took care of their, and I'm still taking care of their autistic child. And there are a number of things. This is a set of 3 DVDs. It is called the Sunrise program. The Sunrise, S-O-N, the Sunrise program. It is coming from the Autistic Treatment Center of America. It is a home-based program for parents to go through and see how you can handle your child on day-to-day life activities. There are a lot of challenges. In this Sunrise, they talk about the miracle of love. In this one, they talk about autism solution and the how to get started with the autistic child. And in this one, they are talking about experiences of different parents about how to handle their children. So these are some things which are available online. You can order, or you can come and borrow from us and then make a copy of it, provided you write for permission to make a copy. It is possible. And here we will put a screening chart. This you can do it yourself. This is a self-administered, takes you 5 minutes to administer this questionnaire, and you can detect your child whether is a suspected child with autism. We have 23 questions, and you can do this in 5 minutes. And it is a self-administered questionnaire. So if I read this questionnaire, for example, I said, does your child enjoy being swung or bounced or play ruka ruka? Yes or no?
So amazing, with the yes or no, it's given points.
You give a point. So yes or no. Does your child take an interest with other children? Does your child like climbing trees or things or sofa sets or gazi or things? Does he like climbing and coming down? Does your child enjoying playing peekaboo? Hide it in hello, hey, you peekaboo, hide and seek. Does your child ever pretend, for example, to talk on the phone? He found you talking on the phone and he picks and he also does hello, hello, imitating. Does the child take care of a doll or pretend to play with other things? Does the child use an index finger to point e khape, e eran kare to, e apa, pale, point a finger? Does the child point a finger to you to indicate something which is interesting? Does your child play properly with cars and toys? If he has found an interesting article or a toy, does he bring to you to show you, mommy, mommy, look this? So does the child look at you in the eyes for more than 1 or 2 or 3 seconds? Does the child oversensitive to noise? There is little noise in the blender and he says, does his child plug his ears whenever he hears any noise? Does the child recognize your smile? He sees you angry, and then when you smile, he also feels happy about your smile. Does he respond to your smile? Easily smiles to you. Does the child imitate you willingly? Does the child point a toy across the room? Is he able to walk or like you to hold his hand and walk with him? If you are both looking at something and then you suddenly turn your head to look at another thing, does he also look at you looking at that other thing? Does he make unusual finger movements all the time? Just all the time finger movements. Does he make this abnormal? Does a child appear to be deaf at times, doesn't listen to you? At times he listens, at times he doesn't. Many times he doesn't listen to you. He's able to hear, but he doesn't want to listen. I call him and he's not responding. But he's not deaf, he's hearing. He puts his TV program and listens to the cartoon and things. But he just doesn't want to listen to me. Those kind of things. Does your child understand what other people say? Does he just stare at something without any purpose? Keeps on just staring.
For hours.
For a long time. Or does he check with you on your face if you are happy or angry? So now these are 23 things which I have just mentioned. You just circle, and the next page indicates out of these how many were yes out of these 23, how many were yes and how many were no. And then there are some critical items in this which are indicated, such as moving of fingers,
which is abnormal.
Sensitive to sound, not listening to you, not imitating you, those kind of things which are critical. If they score no in more than 4 of them, these are items. If more than 4 of them are scored inappropriately, then you need to go and see a psychologist or a pediatrician.
So 4 is the cutoff point.
Cutoff point. And most of the time, I have used this in my clinic. So number of children who have been brought with that kind of suspicion, and fortunately it has been a very good tool. We haven't found any of those who were otherwise normal to have this. But I have about 17 autistic children in my practice. And all those children, when we use this scoring sheet, they actually scored poorly, indicating that this scoring tool, which is called MCHAT, M-C-H-A-T, it is available for free download on the website, provided you just acknowledge the source. The source is Diana Robbins from George State University and Deborah Fain from University of Connecticut. I acknowledge them in public here that I am using their tool. As long as you acknowledge them and saying you have used their tool, this tool has been translated in more than 18 languages worldwide. And it is very effective because 100% of all those who had autism fitted in this tool. And we used this tool and found many of those who were suspected did not have. And one of them who had suspected who had, which fitted in the tool. So it is a very effective tool. You can use this tool in your day-to-day practice. And for mothers who are able to download that from the website, MCHAT, if you go Google MCHAT, M-C-H-A-T, for autism in toddlers, you get it free. Acknowledge Diana Robbins and Deborah Fain from these universities, and you can use it. Or if you need a professional person, you can go to any pediatrician. They can have this scoring sheet with them. They can do a rapid assessment and tell you, don't worry, your child is fine.
Okay. As we are approaching the end of our show, Professor, what would you like to advise our viewers?
2 major things. First, you must be aware that autism is there, number 1. And they are different. They are different and you have to understand them, number 1. And number 2, you need to be careful of the environment and the things we are pumping into our children. You need to be careful of what you are feeding them because they have profound long-term consequences. And when you have any doubt about your child's neurodevelopment, seek help sooner than later. This is my advice.
Okay. Thank you so much for coming to our show, Professor. I'm sure
very
our
much.
mothers have learned a lot. They have to be very careful. If they note anything that's abnormal, they have to report immediately.
Thank you very much.
Thank you so much.
Thank you. Thank you very much.